Hi, everyone. Welcome and thank you for joining us today. My name is Khadine. I'm the Director of Advocacy and Intergovernmental Affairs here at the ACLU of Illinois, and I'm really excited to be spending this hour with you and my colleague, Amy Sherman, with Compassion and Choices Action Network. Just a few notes before we begin. We have live captions at today's event. To turn them on, please click the Show Captions button on the bottom of your Zoom window. If you're having difficulty viewing the captions, please message ACLU-IL events in the chat. You can submit questions during the event by using the chat or raising your hand in Zoom, and we'll call on you to ask the question out loud. If you have tech-related questions, please message ACLU-IL events in the chat. It's a really exciting time in Illinois for the issue of medical aid in dying. When I first started working on this issue over 12 years ago, I wasn't sure if we'd pass this legislation in Illinois, but now here in 2024, in part because of the work of so many of the folks on this call, we're in a moment of when and not if. So today we're going to go over an overview of aid in dying. We're going to give you some messaging tips and tricks. We're going to do a mini Advocacy 101 training, and then we'll be doing questions. So I'm going to hand it over to my colleague, Amy, with Compassion and Choices. Amy?
Thank you so much, Khadine. It is such an honor to work with ACLU of Illinois on this issue. It's been several years now, and I can tell you we are very excited about what's happening in Illinois. We think there's definitely a when and not an if about what's going to be medical aid in dying in Illinois. So I'm going to share my screen, and my goal today is to talk to you about really the basics around medical aid in dying. Some of you have done a lot of training, and this will be a review for you. But for many of you, this is going to be maybe the first time you've heard an overview around medical aid in dying. And then I'm planning to really connect about, hopefully, more about messaging, hopefully getting you a sense to feel more comfortable about how to approach legislators, what key points to hit on. I do want to say before I start, first of all, thank you for making this time. It really is a part of getting yourself ready to be an effective advocate. But also I want to say you don't need to expect yourself to become an expert because of one training session. You are going as a constituent, you are going there to express your views. And if anything I say and you get asked about and you don't remember, don't make up the answers. It's okay to say, I don't know, or I'll get back to you. So don't feel that you have to learn every single thing I'm talking about. Let's go. I just briefly want to say what Compassion and Choices is, since there's two organizations here. We are a national nonprofit, and our focus is on improving the quality of care and expanding options at the end of life. Really, what it's all about is empowering people so we have more of a person-directed, patient-directed approach to end-of-life care. If you want to learn more about us, you can do that by checking out our website or talking to us afterwards. But what I really want to focus on now is the basics around medical aid in dying. So what is medical aid in dying? It allows terminally ill adults to request and receive a prescription for medicine that they may choose to take to bring about a peaceful death. To qualify, the person has to be mentally capable, able to self-ingest the medication, in other words, take the medication, and have a prognosis of 6 months or less to live. These are the key elements of this. And I don't want to waste any time. I've got to jump right in and say to you, we are thrilled that in February, Assistant Majority Leader Linda Holmes introduced the End-of-Life Options Act. This is for terminally ill patients. It's SB 3499. You can see here, I don't know if you recognize any of your representatives or senators here, but we have a good group of co-sponsors. Right now, the legislation is in the executive committee, actually the subcommittee for end of life. I do want to note that Senator Castro is the chair of that committee, so that's good for us. But we are getting a lot of attention around this issue right now. And what our hope is that you can take what you learned today and go and reach out to your legislators. And I know Khadine will talk about that. So what are some of the eligibility requirements? And these are all things that are present in the legislation. The person must be an adult, 18 years or older. They have to be terminally ill, and that's a prognosis of less than 6 months, 6 months or less to live. And I do want to say that's consistent with the hospice definition that's established by Medicare. And it's very important that when you're doing legislation, you look at definitions that are already in the law. That's a strategy that makes a lot of sense. This is something that's accepted generally by legislators as a definition. We also think it's very important because of the underlying underpin of this being as acting voluntary. The person must be mentally capable of making their own healthcare decisions. That means they can give informed consent. And as I mentioned, they need to be able to self-ingest the medication. And this is to protect against euthanasia claims. Euthanasia is legal in this country. Euthanasia is when the third party can inject medication, or somehow a third party administers the medication. You can think of like a Dr. Kevorkian. That is not what this bill is. So right now, we have 10 states and Washington, D.C., where medical aid in dying is currently authorized. That means that 1 in 5 adults live in a state where it's authorized. And our view is that it shouldn't matter where you live. You should be able to have access to this. If you want more details about each state here as that it's listed and how the medical aid in dying was authorized, whether it was legislation or ballot, or court case actually for Montana, you can check out our website, but most of the states became authorized through legislation. And the process, I think, is important for you to understand. When a patient receives a terminal diagnosis, they may request a prescription, and in that situation, 2 physicians must confirm eligibility, that the person is terminally ill, that this is not because of age or disability. Also, the providers must confirm that there's no coercion. Coercion is actually subject to criminal prosecution. This is important for you to emphasize because you will find opponents raising alarms about potential coercion and abuse of medical aid in dying. There are more than a dozen strict requirements, safeguards in the legislation. Let me go over some key ones. I've already mentioned the 2 separate physician assessments of eligibility. I think please make sure to mention that 2 doctors separately take a look at this. Also, there's mandatory education about all the options at end of life, including hospice and palliative care. In fact, that's specifically mentioned in the bill. And we have seen in other states that this has actually promoted some very positive patient-doctor conversations about end of life. Also, if there's a concern by the attending or consulting physician who are doing the assessment around eligibility, if they're concerned about that person's capacity, their ability to make decisions, they may refer for a mental health evaluation by a mental health professional. In our bill, that's a psychiatrist, clinical psychologist, or a licensed social worker. There's also a request process. The person must make 2 oral and 1 written request. There is a 5-day waiting period between oral requests, although there is a waiver if the physician feels that death is imminent. It is a felony, as I mentioned, to coerce someone to request medical aid in dying medication or to forge a request for it. So there's very harsh penalties for playing with this. I will tell you, in the over 25 years that medical aid in dying has been available, there has not been 1 substantiated disciplinary charge filed. There has not been any criminal action taken. So the evidence shows that the safeguards are working. Here I am saying this again, but this is really important to mention. If somebody brings up fears of abuse, that just isn't the evidence. That's not what we've seen. And in fact, this is very rigorous. This is not an easy thing to get. But what it means is that there's really very little risk involved of abuse or coercion. Some of the things that I would mention, if you wanted to, is the fact that underlying all of this, and I think this is why this is an issue around civil liberties, is that we're talking about expanding patient autonomy. This is a core issue. How you die when you're terminally ill, to me, seems like just the essence of bodily autonomy. And I think I've noticed in talking with legislators that that is something that really resonates in Illinois. So I certainly would want to mention that. I also think the fact that we've seen in other jurisdictions where medical aid in dying is available, and an overall lifting of end-of-life care, including greater utilization of hospice. So that's something you might want to mention. It helps far more people than choose to use it. We find it's a very small percentage, less than 1%, who opt for medical aid in dying where it's available. And even a third of those who opt for it end up not using the medication. But we have seen that just knowing the option is available has, and there are studies that show that it reduces anxiety and helps people have a better sense of well-being at end of life. And then a very big one, this maybe should be number 2, optional for patients and doctors. No one is forced. There's no mandate involved in medical aid in dying. And so when you hear those who object, that's fine. They don't have to do this. It's in that way, I think it's similar to some of the other issues that we've worked on around autonomy, but it is wholly optional, not only for the patients, the doctors, but also the medical system. Not have to participate. And what we found by doing that is I think it's really helped with getting support from physicians. If you see here, this is a survey that was done by WebMD Medscape in 2021. And as you can see, 65% support legislation when they understand the stipulations, the safeguards that are in the legislation. So the majority do. And actually, I think it was, I don't remember the specific number, but it was a very high number that said they'd like to have the option themselves. So this idea that all doctors oppose this is incorrect. Also, we have seen a movement, and I thank Khadine and I thank our team. We've done a lot of work with the Illinois State Medical Society, and when we originally started to get involved in a campaign, they were adamantly opposed and called it assisted suicide. They have since last April, actually, they adopted a position of engaged neutrality, which means they're not supporting or opposing, which I think is very fair. They're reflecting the fact that people have different views in their membership. Physicians can follow their own conscience, and they really want to make sure that physicians are protected in terms of their decisions. But also, I think what I think is great is they've really been at the table in terms of the bill, and also educating. I think when the bill is passed, they will be there as a resource to educate physicians and lawmakers. So that was a very important development in the campaign. I also do want to mention very quickly, because you may be asked about this, the AMA also, it does have a position where it says it opposes assisted suicide, but it also has a position through its ethical council that physicians may participate in medical aid in dying without violating professional or ethical standards. So I think that's important for you to know and share if that comes up. Let's talk about the public support. 7 out of 10 Illinois voters support medical aid in dying. We had a really wonderful poll that was done by Impact Research. And by the way, don't say we had, I always do that. Impact Research conducted a poll last year, and it was 700 likely voters in Illinois. Impact Research is known was very highly regarded by senators in particular. I think they've done work for the Democratic caucus. And they found not only 7 out of 10 Illinois voters support medical aid in dying, but this cut across race, it cut across age, it cut across religion and gender. And I think some of the interesting points to note is 73% of those living with a disability supported medical aid in dying. As you can see, for the Latino Hispanic, support medical aid in dying, and for white and Black likely voters, 69%. These are pretty important numbers. And then finally, I just wanted to mention 69% of those who report as identifying as Catholic support medical aid in dying. I mentioned these because our most active opponents are the Catholic Archdiocese and those in leadership in the Catholic Church, and certain disability rights advocates. So important to know in terms of public support. These are just data points that I thought I'd share that are in our utilization report, which is online. It's from the 9 states that report on data each year. They do an annual report about utilization. I think one of the most important things, and I would try to mention this in a meeting if it comes up, 88% report that they were already enrolled in hospice or palliative care in the states where this data was available. This is not an either or. I think that's really important in this. This is for those, small number of people where hospice or palliative care is not enough and they are suffering. Another one is over 75% die at home. The vast majority of people in this country want to die at home. And unfortunately, the majority die in acute care facilities and nursing homes. Now, sometimes that can't be avoided, but I think it is really powerful to see that people are able to, realize their wish to die at home with medical aid in dying. You're going to see gender equally represented. People of color are underrepresented. This may be something that you hear. And I think that's, a lot of that is education and getting out into those communities, looking at the inequities that we see already in healthcare, and think really working with those who work on those issues. And we are doing all of that. But also we know that there's also religious components for some. And the important thing, again, to stress is that no one has to do this. And then in terms of diagnoses that are most common, far and above, it's cancer. It's terminal cancer. That makes up the greatest number. And that doesn't surprise me because often people suffer, not all, but often people suffer with terminal cancer. Next is neurodegenerative diseases such as ALS, and then followed by cardiovascular diseases. So far across all jurisdictions, 8,729 people have taken prescriptions. 37%, as I mentioned, never take it after they get the prescription. And as I mentioned before, less than 1% use the law. So that gives you a sense of what's there. Let's talk about messaging. Now, I just want to say in terms of messaging, it's really important. Words are powerful. People grab onto words sometimes, and then they're not listening. And that's why we think it's important. We want to focus on that movable middle, the people who maybe haven't made up their minds yet, who are uncomfortable about this, but want to learn more. I will tell you, there are plenty of movable middles in the legislature, and we worked on a lot of them, and we have seen them move, but they're still there. And I also want to say it's really important to think about public thoughts and private thoughts. You may have an opinion that's really different from the model we have. This is the model we are working on. And so what I want to ask people is, you can share your private views with everyone, but when you're talking to a legislator, if we could stick to the messaging, it's really helpful. We want to move this bill. So this is the key message. Terminally ill adults should be able to make their own end-of-life care decisions based on their values and priorities in consultation with their doctor, their loved ones, and their faith spiritual leaders if they have one. If you memorize this, you'll be in good shape in terms of an elevator speech. And language, as I said, matters. There's a few terms that we ask you to avoid, and this is based on our work in focus groups. We've done quite a few of them, and on the ground experience, because they can generate negative reaction. And terms to avoid, we have found with control, for some who are religious, they are offended because they feel this is God's will. This is really God's jurisdiction to decide when you live or die. We like to use terms like options, choice. Certainly, as one who very much supports reproductive justice and all those options. I've had to learn not to say the term choice, but I will, and it's in our name, so it sounds sort of silly that I'm saying this, but we have found that some people equate choice with abortion rights. Nothing wrong with that, but remember, we're trying to see if we can get those legislators who maybe are not supportive of abortion rights, but may support this. And I have talked to legislators who have made those delineations. Also, I think we like terms like decision-making, which we think are a little more proactive as well. Rights. Talking from right-based language, we have found is a turnoff for some people. And what we found is things like compassion and love and values, that kind of messaging really speaks to the heart. Death with dignity probably was one of my favorite phrases when I first started at Compassionate Choices. I thought it was a great term. What happened is I found that there are those who are offended by that because they interpret it as saying, if you don't die from with medical aid in dying, that you're saying anything else is not dignified. And I want to tell you, I actually heard this firsthand when early in my days, I was listening to a hearing, and one of the opponents who was a legislator on the committee started talking about her husband who has ALS. And are you saying that he's not dignified because he's on, he's got tubes and doing this and, whatever. She went into a whole story about really a pretty tough existence that he was having because he was at end stage. And I have to say, it really resonated. She was very upset. So I would avoid using the term death with dignity. I really like death that aligns with our values, beliefs, and priorities. I know it's a lot more words, but I think it's effective. And then self-administer, you'll even find self-administer in our bill. People think that often, they get confused. They think it might be euthanasia. They don't really understand what it is. So I think take and self-ingest are good words to use. So those are some. If you end up using one of those words, do not beat yourself up. We are not the word police. We just want you to know. Another one I would mention is, and people use this all the time too, we treat our animals better than we treat ourselves. I think that's true. The one question with it is because that typically is euthanasia. So the third party, again, administering the medication. We try not to use that as an analogy. So just wanted to mention that. Remember, it's the illness that's ending the person's life. Please avoid phrases like life-ending medication or taking medication to end one's life, because that can imply suicide. Also, we don't use physician aid in dying, again, because of the issue around the role of the physician. This is something that you have to do on your own. You self-ingest, and we can talk about how that happens. But again, we want to try to keep euthanasia and medical aid in dying separate. And I already mentioned this about the animals. So those are a few tips. I do want to also mention the death certificate. The bill provides that the death certificate will show the underlying disease as the cause of death. I think that's important. It's not, it doesn't say cause of death, medical aid in dying. It is the cancer or whatever else that caused the death. Addressing opposition. Believe me, our opposition is talking. They're out there, they're talking to media, they're talking to legislators, and our legislators are going to ask you, what do you think about this? And so I just came up with a few of the most common arguments I hear from opponents, and wanted to help just go over things that you can say. So number one, medical aid in dying is suicide or assisted suicide. It's really important for us to distinguish between the two. With medical aid in dying, death is inevitable due to the incurable nature of the terminal illness. The majority, I would say, and I don't think we could, you don't even get into this, but they want to live. They don't have a choice. This is something where they're dying, and it's about the manner in which they're dying. Will it be peaceful? The laws allowing medical aid in dying do not eliminate laws prohibiting assisted suicide. Again, they are considered separate things. And medical aid in dying is about letting people who are terminally ill enjoy the highest quality of life possible in their remaining days without having to worry about dying with pain and suffering. And many of our storytellers talk about this, that this is really about being able to be very present in the days that I have left. Another argument, claim that's made is medical aid in dying is a slippery slope. Look what's happening in Canada or in Europe or somewhere other than the US. I thought it might be helpful to look at sort of where things are in the US. It's a completely different model than Canada. For example, in the US, as we know, we require self-ingestion. In Canada, euthanasia is allowable. In the US, it's a terminal illness. In Canada, it's a serious and incurable illness, disease, or disability, much more expansive. In the US, we've had a consistency in the core eligibility requirements for over 25 years. In Canada, it continues to evolve. And I think a part of that is in the US, this is based on state law. States have to look at this. They have to look at any kind of change that happens, any amendment. And in Canada, it's done on a constitutional charter. It's just apples and oranges. And I think that's very important to come on strong to show the differences. Another claim is that medical aid in dying will lead to coercion and healthcare rationing for people living with disabilities. And our response is that medical aid in dying does not harm marginalized populations. We actually have confirmation of that in terms of some reports that have been done, and even a letter from a former director from Disability Oregon. So I just want to say before I talk about the response, the first important thing to me is to be respectful and express compassion, because we agree that there are legitimate concerns about healthcare inequities and discrimination for marginalized populations, and we support change. However, we also feel very strongly, and the evidence shows that medical aid in dying has no negative impact on these populations. And, you know, for example, the law itself says disability and age cannot be a factor for eligibility. The person must be terminally ill. It is not you are living with a disability, it is that you are dying. There are no substantiated cases of fraud, abuse, coercion. There's been no criminal or disciplinary charges in over 25 years. And as we mentioned before, 73% of Illinoisans with disabilities support medical aid in dying. And who should speak for them? I think that's really important. Shouldn't they have this option at the end of life? Other things you might want to, you know, just try to remember to emphasize: this is wholly voluntary. It's been safely practiced in authorized jurisdictions for over 25 years. We have a lot of evidence it's working. Most people who opt for medical aid in dying are already enrolled in hospice. Without this option, many terminally ill people will suffer needlessly instead of dying peacefully. And it's sad for me to share, I know people who are facing very difficult deaths, and we may not even be in time for them. That sense of urgency is important to convey. For medical aid in dying, an overall improvement in end-of-life care. And so a big part of that is more dialogue between patients and healthcare providers, and reduction in anxiety around end of life. So these are all benefits that you might want to stress. I am done. I am going to turn this over. I know that was a lot of information. I want you to know we do trainings on this all the time. So if you're interested, please talk to me, talk to Chloe. You'll get our contact information. So I'm going to stop sharing now and turn this back to Khadine.
Thanks so much, Amy. And so our next part will be a very speedy how to talk to legislators presentation, and then we will get to your questions. I try to tell people that I want to slow down in my talking. Maybe just for today, I will continue to be fast just so that we can get to the questions, which I think are an important part. So I am going to share my screen, and 1 second here. Okay, so just thinking about what success looks like for our conversation today. At the end of this, I want to make sure that folks know who your state senator and representatives are, who represents you, know where you can go to find their contact information, which is ilga.gov. You have the tools and the information you need to reach out to your state rep and senator in support of Senate Bill 3491, and you are feeling confident and excited to reach out to your elected officials. So the first thing is knowing who represents you. That's the first step in making change, is to know who those people are. So for the purposes of our advocacy at this point in the bill, as Amy shared, the bill has been introduced in the Senate. It is in the Illinois General Assembly. So our state senators are our first priority, and our state representatives, because once it gets through the Senate, it's going to go to the House. Fun fact to remember, sometimes when we ask people who represent them, they think of their congressional representatives, but a reminder that we're talking about our state level folks. So there may be, if folks have, if you have your phone available, you can scan this code. If not, there's this link that's here. I think Kayla will put it in the chat. And you may already know who your elected officials are, but this is just a resource people are able to use. Just to walk you through it, if you scan the code or you click the link, you'll get a message. You click OK, you enter your home address, you scroll down to state senator, and that will give you their name, their district number, and it will take you to their ILGA, so Illinois General Assembly. You'll hear me say ILGA a lot. Their page, then you can go back to the app and then get to their state representative. I know that's a lot to process at this time. This is going to be recorded. So if you're listening to this and it's recorded, you can pause, go backwards. So you have that link. And again, Kayla is going to put it in the chat, and we're happy to share this slide with folks afterwards. So now that we know who your members are, this is the buffet options on the advocacy menu. So these are all of the different ways folks are able to engage with legislators. There are probably more, but these are the ones that I've identified. So they're in district office visits, remote visits, phone calls, emails or letters, action alerts. I hope you all have taken at least one action alert in your past, and I hope you will be taking lots of action alert in support of this legislation. There are legislator events like town halls, constituent coffee, office hours, especially during this election season. Social media is a good way of engaging, Springfield visits, and advocacy days. So there's lots to talk about, but for today and for the purposes of this legislation and what we hope will lead to a couple of weeks of action while legislators are on spring break, is to focus on in-person visits. So that's an office visit in district, and remote visits, which are virtual visits. I'm also doing a shout out to phone calls, because if you're not able to do an in-person visit or remote visits, calling your legislator to let them know that you support this legislation, Senate Bill 3499, is really important. And if you are not phone oriented, letters and emails are great. And by letters, I mean the old school handwritten letters. From my conversations with legislators, whenever they see a letter, they think that, oh, somebody took an extra step, extra effort. So they tend to value those a lot. And emails are always welcome as well. Both emails that follow an action alert structure, or an email that you have set up, created yourself, that talks about why you're supportive. So one of the very important things is to set up a meeting. So when you call to request a meeting, it's important to be clear about your ask and your preferences. So you want to identify yourself and what issue you're hoping to meet on. You want to let the person who answers the phone know that you live in the district. You want to be clear if you want to meet in person or virtually, sharing how much time you're hoping to have with your legislator. Are you attending solo or with a group? And depending on the legislator, sharing your position on the particular issue. Be prepared to send a follow-up email with materials like a fact sheet or a one-pager. Kayla is likely going to put a link. Our ACLU bill page has some of our fact sheet materials, and we also have coalition materials as well. Sometimes people ask the question, what number do I use? Because if you were to go to ILGA, ilga.gov, ILGA, as you'll see at the bottom, is your friend. It truly is. You will see district information and Springfield information. The number you use depends on what time of year it is. During non-session time, so when they're not in session. So for example, this whole week, the House and Senate, they're in district. And next week, the Senate is in district as well. So you start with their district number. And then on session days, you start with their Springfield number. So just to kind of put in an example of a phone conversation or email outreach when you're reaching out to legislators. It can say, hi, my name is Khadine Bennett, and I'm a constituent. I'd like to schedule a 30-minute in-person meeting with Senator Bennett this week or next week to talk with her about Senate Bill 3499, the End of Life Options for Terminally Ill Patients Act, sponsored by Senator Holmes. If you have never talked to this person before, have no idea about where they are, you can, I encourage you to add something like, I'm supportive of this legislation and would like to meet to share why I'm supportive and to learn more about her position. If you've talked about this issue before, it's a good time to circle back. I've talked with her about this legislation previously and wanted to follow up now that it's been filed. So those are examples in action of the points from before. So one thing to encourage you is to be persistent. Don't give up. If you called once and nobody returns your call, I suggest calling over emailing, but at some point you may need to do both, and you may need to do it multiple times. So without being aggressive, following up via phone and email is important. In terms of setting up a meeting, keep in mind that sometimes things come up and schedules change. So it's always helpful to call the office and reconfirm your appointment. So depending on how far in advance you've scheduled your meeting, it's a good practice to confirm your meeting 2 business days before you're scheduled to meet and the morning of the meeting, because I've been in the situation where you get there and they forgot that you're meeting and there you are. So to prohibit that from happening, doing that check-in can be helpful. The next thing is to have a clear goal and plan for the meeting. So some of the things I think about, is it you're going to that meeting to educate the elected official about an issue? Are you asking them to support or oppose a specific piece of legislation? Are you gathering information about their position on the issue, or is it all of the above? And for us on this issue, success for us and for you looks like, first, you're asking your legislator to support Senate Bill 3499, and you're getting a clear answer. That clear answer could be, yes, I'm supportive, no, I am not, or I'm undecided. Some of and I'll talk more about this later, sometimes you ask questions and legislators are like, that's a really great issue. I'm so happy you came, and I'm really glad that you're doing work on it. And sometimes people hear that as, oh, that legislator really, they're all in with us. And unless they are clearly saying yes or no, or they're undecided, then it's a little bit of a gray area. So success also looks like that you're offering opportunities for support from the coalition. So Amy had talked about some of the messaging and the work that our CNC is doing and coalition we're doing as well. But some of the other things we are able to offer are talking points. So if when I meet with legislators in Springfield, if they want to figure out how to talk about a particular subset of this issue or just the bill in general, we're able to provide them with talking points. If they're getting bombarded with calls from opposition, we're able to help them with responses to push back. If they're interested in doing an educational town hall, we're able to help support that as well, and letters to the editor and anything else that could be helpful. By offering those opportunities, it does not mean that you're responsible for executing them. Just let us know, and I'll have information towards the end where you can give us that information. The other part of what success looks like is that you can learn more about the kind of outreach that your legislator is getting. Is it mostly supportive? Is it mostly opposition? What are the groups they're hearing from, or if they're hearing from no one at all? So we have our meetings set up. We confirmed 2 days before that we're ready to go. So the next step is preparing for the meeting. So the first thing is aligning your talking points. So think of the things that you have to cover in order for that meeting to be successful. So first, you want to thank the legislator for the meeting, helps to thank the scheduler as well, and really be able to think pre the meeting and talk about why this issue is important to you. You want to be able to provide a big picture overview of the bill, so you don't have to be deep in the weeds like Amy or myself might be, but using a fact sheet that gives you kind of the big talking points, you're able to even identify, like I think on our fact sheet, there are probably like 12 points about the bill. What are the 5 of them that resonate most to you? I think one of the things we talk about is that this is legislation that would allow people to end their life in a peaceful manner if they're they're terminal, 6 months or less to live. If they're an adult, it is optional. So you pick out the items that you think either resonate with you or things that you think would be important for your legislator to hear. You also want to be able to have space for legislator questions because we want to give them information, but it's also helpful for us to hear the kinds of things they're asking about as well. And you definitely want to make your ask, and then you want to confirm whatever the next steps are. If you're not going solo, you're going in a group, then you want to be able to meet up, check in with that group, and assign roles before you meet. So there's a lead person who's the point person for the conversation. If there are other constituents, they are prepared to share about why this issue is important to them. And then a very important role, the note taker who documents the position, the needs, and any kind of follow up that's required. If you're going by yourself, then you will be all of these things in one. So other part of preparing for the meeting is you're at the meeting. So your elected official may not be on time, but you definitely should be. And being on time is being early. So you want to plan to arrive between 10 to 15 minutes early for an office visit. You never know what's going to happen with traffic, and just to get yourself ready to go. And then 5 to 10 minutes early for a remote meeting. And when I say remote meeting, I mean Zoom, WebEx, FaceTime. I think Skype is still a thing. And if you're not used to using that kind of technology, maybe start a little bit earlier just to make sure that everything's downloaded and you're ready to go. And when the legislator or their staff show up, you're all ready and relaxed to go. If you have materials to share, it's always helpful to send them ahead of time. And I think you want to start with like maybe 1 or 2 things. Getting 10 attachments on an issue can feel overwhelming. You will always have the opportunity to send information afterwards. So kind of like pick and choose the best items. I will always go with a fact sheet or a 1-pager because that tends to give all of the information in a very in a digestible way. Whatever you send them ahead of time, always bring extra copies with you because they may have it, but you never know. The one time you don't bring the extra copies, that's the time you need it. It's also a good time to reconfirm your must cover list in case your meeting runs short. So as you're going into the meeting, just getting a sense of like, these are the things I have to cover no matter what when I have my meeting. For group meetings, it's a good time to remind the members about their roles and make sure that everyone is on the same page about who's talking when, about what, and also for how long, which can also be good info. You want to make sure that you know how much time the legislator has to meet with you. So remember a few slides ago, I talked about, can I meet for 30 minutes with Senator Bennett? So you're set, you think you have 30 minutes, you come in and you confirm, how much time do I have with Senator Bennett? And like, you know what, we now have 15 minutes with Senator Bennett. So you don't want to be surprised in the middle of a meeting where the senator realizes that, oh, I should have told you before that I have less time. Things come up in meetings, but again, it's good to confirm and then just make sure you adjust your agenda to hit your key points. Let's see. Okay. So the next thing is sharing why this issue is important to you. So Amy gave us numbers and facts, and those things are very helpful. There are legislators who love some facts, love some stats, love some polls, but sometimes, especially if it's coming from a constituent, sharing their personal connection to the issue can sway an elected official our way. And we've seen that with lots of the folks who are storytellers who are able to share their story. Deb Robinson is one of those folks who is has a terminal diagnosis. Susie Flack is the mother of Andrew, who Andrew passed away, but his mom is now taking on the work that he was doing before he died to talk to legislators about why it's really important for people in Illinois to have this access to care and not have to go somewhere far away like California and rely on family members to be able to afford to go to them at the end of their life. So that personal connection is really critical. So it's important for you to think about why this issue is important to you and the personal connection you have. It's also, there are some unique perspectives that can be really helpful as we think about who are the folks who are either opposed to the legislation or who are implicated in the legislation. So for example, are you a person of faith? Talking about why you're supported from that perspective can be helpful. Similarly, if you're a healthcare professional, that you're a healthcare professional, you believe that this is part of the spectrum of end-of-life care. A person living with a disability, why for persons living with disabilities who are terminal, this is important to you as well. And if you're a hospice or end-of-life care volunteer, you're in a great place to be able to share why this option is a really important option and tool. So as Amy mentioned before, in a different way of saying it, but no information is better than misinformation. There's a lot to learn about this issue. Amy's been doing it for a long time. I've been doing it for a while. I'm still learning. Amy's still learning. So we don't expect you to be experts at all. If you don't know the answer to a question, don't guess. You can always follow up with additional information or answers to questions after the meeting. And that could be a great way to circle back with somebody who's undecided to say, oh, you wanted this information? Here you go. By the way, where are you on the issue? Just don't forget to follow up. And then if there are questions that you get, let us know if there are questions that you need us to help you respond to. We're not giving you this information and then going away. We really want you to keep coming back to us if you need clarity or help answering questions that may come up. Very, very important is to make your ask and get a response. So don't leave the meeting without making the ask and getting a clear response. So if folks know me, I like to be direct as much as possible. And in this case, it's, can I count on you to support Senate Bill? Oh, sorry about that, House Bill. Senate Bill 3499, legislation that would add medical aid in dying to the end of life options available in Illinois. You don't have to say it exactly like that, but you definitely want to ask the direct question, will they support this legislation? So examples of a clear yes is, I will support, I will vote yes. No's are, I can't support the bill at this time, or I can't support this bill, or it's not a vote I can take. And then the undecided, I'm not sure where I am at this time. I gave you earlier that kind of no, that sounds like a yes, where it's like, you're really passionate. This is a really compelling issue. I really hope that it gets over the finish line. And I think in those kinds of situations, it's okay to say, so is that a yes, you will vote for the bill? And maybe trying a couple of times. And then if it is clear that they're not interested in giving you a yes or no answer, I think that they would be in the leaning no, undecided, but likely leaning no column. So I want to share compassion and choices, 5 items for notes. These are things that after, or, if your note taker is taking notes, these are questions for them to be thinking about. These are things for you to be thinking about as you're going into the meeting. And when you're done with the meeting, capturing these things really quickly if you didn't type them in during your meeting with the legislator. So first is, what questions came up during the meeting? Questions from the legislature, even questions for you that came up. What was the legislator's position? Was it supportive, opposing, leaning yes, leaning no? Were there any red flags or concerns, and describing those as much as you can? And those red flags or concerns can be about the legislation. It could be about opposition. It could be about supporters. It could even be about a dynamic that played out in the meeting itself. Does the legislator have a personal connection to the issue, and describing what that may be, and what are the follow-up steps? This list is super helpful as lobbyists because when folks do the visits, we get access to the list, and it either confirms things that we know about this legislator, or it gives us new information, or it shows if there's a conflict. So it's very critical to have this information sharing by folks who do visits. Again, saying the things that maybe doesn't need to be said, but saying it anyway, being respectful. It's so important to be professional and treat all elected officials and their staff with respect, from the person answering the phone to the staff at the office, who they're the ones who make sure we're able to have these important meetings that we need to have. And also to the elected official who's against you on the issue, or even advocates who are not aligned with us on these issues. Treating any of these folks poorly really helps with moving the issue forward. And for us, we can agree to disagree, even though these issues are so personal. And throughout the years of working on this, like Amy said, there have been people who have been passionate about wanting this, who have needed it in their own lives, who haven't been able to live long enough for it. So it is a very personal issue, and it feels like the time is ticking. So even in those moments where there's frustration that either a legislator just doesn't get it, or an advocate on the other side just doesn't get it, it's really important for us to continue to treat folks with respect. However, if you've had a bad exchange with the legislator or their staff, please let us know. So we want to treat people with respect, but people should also treat us with respect. So if anything bubbles up, please let us know. And that could be in the 5 things list, or you could just reach out to us and let us know ASAP when those things happen. And then a reminder that you represent yourself unless. So you are constituents exercising your right to engage with your elected official. Unless you have explicit permission to represent an organization or a coalition, you're representing yourself. So we have probably ACLU members who are listening. We have Compassion and Choices members. We have even staff people at our organizations. Unless you are explicitly representing the organization, you are lobbying on the bill, you are told that, yes, you are carrying our organizational mantle as you go to have this conversation, you're representing yourself. So it's important to remember that. And it's also important to remember that your voice matters, regardless of whether you speak from an organization or just for yourself. There are times where it is actually better for you to speak as a person who is a constituent versus a member of an organization or a staff member of an organization. So to close, please keep us in the loop. Let us know if you want to talk before you set up meetings. We're happy to give backgrounds on legislators. If you want to do a role play because it's your first time meeting with a legislator, happy to do that as well. We can answer questions before you meet. I'm sharing my cell number here. And I'm sure that Amy will share information for the Compassion and Choices folks as well. We really, 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 really want to know how it works, how it went. And we really hope that folks are going to engage in this, what we're calling kind of like a spring break week of action. I shared with you earlier those 4 things you can do. It's, in-district visits, it's in-district virtual phone calls and emails and letters. We would be happy if you, started off with a little in-district visit, then you move on to a phone call, then you move on to a letter and an email. So we really want you to take action. It's really critical. And once you do that, we want you to fill out that 5 items guide for notes. And we would also love for you to send an email to advocacy@aclu-il.org to let us know how it goes. If you are a Compassion and Choices member, I know that there's a path that you can go through there as well. But for other folks, we will definitely get any of the information that we have. We definitely share it with the group of us. So don't worry about that. So I hope in this time we were able to help you to figure out who your state senator and representatives are, that you know that ILGA is your friend, that you at least have the beginnings of tools and info that you need to reach out to your senator and representative in support of Senate Bill 3499, and you're ready and confident and excited to reach out to your elected officials.